Now we're hopping on to the next discussion which we'll be doing, and this is all around the joints, surgeries that could be done around the joints. So the first one, we have the word meniscectomy. Second, we have ligament reconstruction. Then thirdly, we have loose body removal. So all of these are actually surgeries that could be done for the joints. Could be any joint, okay, but meniscectomy is mainly for the knee. Okay, so all of them, they're actually orthopedic procedures. They're usually performed to joints, but we'll always talk about knee and sometimes other joints. Okay, so most of the times when I'm talking about knee joint injury, they usually use the knee. Do you understand? So what is meniscectomy? Okay, it's just surgical removal of part or all of a damaged meniscus. Okay, so when the meniscus is torn, okay, then irreparable meniscal tears, so types could be partial or total. You're trying to relieve the pain, you're trying to relieve the knee functions. Okay, so that's it. Then we have the ligament reconstruction. Okay, the ligament. So it's just surgical replacement of a torn ligament with a graft. Most of the times is what? Anterior cruciate ligament. So most of these surgeries could be done elsewhere, but most of the times is a knee. So indications when the ligament has torn completely, when you have done some conservative treatments but they are failed. Procedure is all those graft harvested. So you harvest the graft, you fix it in where there's a tear, and it kind of like comes up. Then we're looking at loose body removal. Okay, so loose body removal is, there are some bone outgrowths. So those bone outgrowths have kind of like broken up, and they are now floating freely in the joint. So if I'm not trying to remove them, I'm saying I'm removing the loose bodies in those joints. You understand? So it's just arthroscopic or open removal of free floating fragments. It could be the cartilage that's cut off, it could be the bones that have cut off, it could be meniscus that have cut off. Okay. Okay, so indications, this is when there is now locking, catching or clicking sensations. As you are moving, there is some noise in the joint. It shows you that some free stuffs moving. Could be caused by what? Osteochondritis, what? Dissecans, could be trauma, could be degenerative joint diseases. So procedure, mostly it is arthroscopy that is used to visualize inside the joint, then also remove the loose bodies.